The Griffin Team Community Meals Program was started in response to the rising levels of social isolation among older adults. Griffin Health Services region is a rapidly aging population. In fact, it outpaces the state of Connecticut's aging population data. The research is very clear in that isolation is a significant health risk that is comparable to that of obesity rates and smoking.
I am isolated, living alone, and it is a need that I have to be with others. We could survive, but we don't thrive unless we're in the company of others.
We devised this community meals programming to bring seniors outside of their homes into a social atmosphere, so they're not only getting assured access to healthy foods that promotes their overall health and aging in place, but creating networks and peer-to-peer relationships.
Many people have talked about financial situations that they're in, or that they're alone at home and they have no one to talk to. And so this is a good way to come out and to experience company with other people. They also talk about problems in their life, that they may have lost a spouse, and how, it's hard for them to get through the day being alone at home. And this is something that they're able to get out and to talk to others.
By coming together for these meals, you feel like you're getting together with family.
There are several people that I know personally that come in, and I know that they don't have the means to go ahead and have a real good meal like this on a daily basis. And this affords them not only a great tasting meal, but a healthy meal.
On a nutritional level, my cholesterol used to be very high, and they serve okra, which is loaded with soluble fiber and foods like that, which I wouldn't normally cook for myself. My cholesterol has dropped to normal. So that's, quite a perk there. I think Hippocrates said, "Let food be thy medicine, let medicine be thy food." I'm really the example of that, I'd say.
They're not only coming together at Griffin Hospital and having a meal together, they're actually coordinating and planning social gatherings outside of Griffin Hospital. And that has a profound metaphysical impact on their overall health and well-being and quality of life in their third trimester of life here.
I met this man at the dinner, and he mentioned that he didn't have air conditioning, lived on the second floor. It was midsummer in the middle of a heat wave. And I happen to have two air conditioners running in my home. I took one, I installed it for him. And when I was up in his apartment, it was the heat was stifling. I give credit to Griffin and team that you guys put this man in my path and enabled me to do that.
When you cultivate these relationships, neighbor to neighbor, peer to peer, and we help each other out, that is a beautiful, profound impact on one's overall health of wellness, mentally and physically, and their quality of life. And Joe's story is one of hundreds that Griffin Health Services makes possible.
We're a social being, and we need to be dependent on other people, and other people are dependent on us, and they bring out the best in us.
It is the state-level exemplar. There's nothing like it in the state of Connecticut, where Monday through Friday, every month, you have close to 200 older adults coming together at a hospital to break bread together and to have these social experiences and cut through that sense of isolation.
So it's good for the community, too, because this way we find out about local doctors or other programs that are available to us.
Griffin right now is giving back to the community. If for any reason that this program gets suspended, I feel there would be a lot of people that would have to go and look for food banks and other alternatives to get their meals. There are a lot of people, because of the way the economy is now, that are struggling and can't afford to eat not only a good, healthy meal, but have any food whatsoever.
And I don't think it's hyperbole to say that it saves lives.
And what an abundance of relationship building and community building results because of Griffin Health Services looking beyond its monolith, beyond its building walls, to build a stronger, healthier, more vibrant community. That's kudos to Griffin Health Services and its donors.
Griffin Health, empowering people, advancing care.